but we're going to deliberately make sure we finish by 1 o'clock sharp for the gun salute, because as far as we're aware, there's not a silence or minute silence that's due to be held within this period. We'll make sure we're finished on time for that. If you have any questions or anything, please feel free to put it in the chat, and we'll ask them as we go along. So yeah, I think without further ado, we'll carry on. So the first speakers are Laura Perry from Imperial College Hospital and Jerry Lowe from Mount Vernon Cancer Centre, and they're going to be talking about local department actions. Take it away.
Perfect. Thank you for the introduction, Rob. So our plan for this session is to help get started with the webinar and how interactive we would like it to be. So it would be great to hear from everyone who has joined us on the call and is participating today. So as Rob mentioned, yeah, my name is Laura. I'm one of the nuclear medicine physicists at Imperial, and I'm also chair of there's an imaging environmental sustainability group within our department. So that's how I got started working and getting involved in these kind of projects locally. And our thought is that it would be great to share what other people are doing at their different trusts or healthcare providers, what's provided locally, and then projects that you've all been working on, so that we can get within the community, we can build up a kind of database of knowledge and communication between people who are making really good progress on these areas. So our first thing to get us started with this interactive session is that we've set up a Mentimeter survey. So hopefully Rob will be able to share the details of that now. So our ask is that either on a different device, your phone, or another window within this webinar, that you all go to menti.com as at the top here, and you can enter a code that is shown at the top to access that, or there's also, I think that link has been copied into the chat. And our first, that should open up on a question which is asking what your work organisation is already doing to improve environmental sustainability. So there's a few broad topics there that you can select, and hopefully select more than one to indicate what your trust or where you work is doing to improve the environmental sustainability. So things that you're aware of. So if you're able to tick those options and submit them, perfect. We've already got some responses, so we'll just give everyone a couple of minutes to indicate those, and then we should get an idea of what the trusts are doing in general. Okay, great. So if we keep going, because I can see that there's a good number of people who've responded, but not quite the same number that we already have in participating. And if anyone wants to add to any chats, anything specific that they want to discuss, I think it's interesting to see the things that are most commonly done across the trust. So the first point there being the one that everyone seems to be selecting mainly is that waste recycling is offered on their sites, and I think that's something that we're all familiar with from home, and so it's good to see that trusts are doing that as well. The lower the intensity of the waste management and handling, that tends to reduce the carbon footprint associated with that pathway, and I've definitely seen different trusts can recycle cardboard, glass, plastics, but that does seem to vary across the different trusts, and plastics are definitely something that we can sometimes find quite complicated with the number of them. And I think I was having a discussion with some colleagues who worked in a trust in Scotland at BNMS, and they were saying their trust doesn't have any recycling at all. So that is something that varies from site to site. I can also see then the next thing is that trusts are encouraging active travel. As someone who works in London, then I definitely, there's a reduction in the number of people who drive to work because parking and driving in London is a nightmare. So we often use public transport for that. And there are also initiatives such as cycle-friendly employer accreditation. So I know that sites can be accredited maybe gold cycle-friendly employers by Cycling UK, and this kind of requires them to provide things like changing facilities, lockers, bike parking, and potentially some maintenance sessions. Other things that it's good to see everyone having some access to water fountains, hopefully enabling us to keep hydrated and keep focused through the day. I guess one of the questions then is how we're accessing those and whether people are able to use reusable bottles, or if there are disposable cups provided at those for patient use as well, whether the cups can be recycled. I know that within Imperial, we have, in the imaging department, we have attempted to replace the cups that are used from polystyrene ones at one of our sites to using a plastic that can be recycled, and we worked with procurement just to basically change the code that was used on the procurement system. So that's really interesting. So other things that I can see, people having options for the vegan and vegetarian food within their, hopefully their canteen. Maybe whether centres are looking at doing meat-free Mondays. And I've also noticed discussions locally about milk provided in departmental fridges, and whether that might be dairy-based milk, or if centres are introducing plant-based alternatives which are known to have lower footprints and potentially are just as tasty in your options. It's great to see some of the comments then as well coming in the chat there. Perfect. Yeah, so I can see that people are looking at electric car charging points. So that seems to be one of the options, and it's good to see that trusts are doing it. And I think by sharing in the chat where this is being implemented or not, helps us argue with our department, or show that this kind of practice can be brought forward. So that's an interesting one to see. And I think we've got some options talking about encouraging power saving that maybe are useful to explore as well, to see what else is going on. It's interesting to see that staff sustainability networks, that a small number of you who've responded to this survey are aware that those are present in your hospital, because we would because part of the NHS Green Plan is expecting that there is each trust is moving forward with a plan to reduce their carbon footprint, and part of that usually requires input from all of the staff. So there often are staff sustainability networks ready for people to contribute to, and to make links across departments, which can be really helpful to drive forward progress. I'll just review the chat to see if there's any other comments. Jerry, you've been commenting away and helping people there. Is there anything that you wanted to highlight?
There's a couple of things. The first one is, as you've already said, staff sustainability networks. We've got one, and I wonder if there's a role for sharing experiences here, because obviously centres vary, things, local issues vary, but it can seem that you're a small group in a very big centre, and my experience certainly, a small group in a small active group in a busy centre where everyone wants to make a difference, and we've shown that with the survey, staff survey, but no one's got any time. And so it really is a kind of a case of trying to optimise our efforts, not put efforts into things that aren't going to work, have been proved elsewhere, and actually to pick up on what others have done that is good. So I don't know, but I wonder if there's a role for sharing sustainability groups in individual trusts, maybe within the remit of IPEM, or maybe Greener NHS more generally. Be interested to hear comments on that.
Yeah, that sounds good. And I guess there's a session at the last session of this webinar is asking for what can we do next? Where can we go from here? So that sounds like a good link in there. Okay, we have Thank you everyone for commenting there. I think then we have a second question, which was just to dig into this a bit more. So it's great to see how aware you all are of what's going on in your department and your trust. The next question is then to try and share any projects that you have been involved in your department. So if you've still got that Mentimeter open, hopefully you should see that there is an open text. You've got 250 characters to summarize any project work that you have been involved in, or projects that you know of in your department that you think might be helpful to share with everyone who's logged in today, so that we can get a real feel for what's going on within the community, and we can share best practice. So we'll give everyone a couple of minutes to enter anything that they're aware of.
In relation to what Joey was saying earlier, we did consider doing a webinar on exactly that, like kind of people showing or talking through what their kind of or their hospital's green plans are. So I think it would be interesting to see the spread of ambition that's within those green plans depending on different hospitals. And if one centre's doing a lot and another centre's not doing much, it might be helpful for that centre that's not doing much to kind of see what is being done. So I think we might kind of do that at some point, but we'll see.
Okay, yeah, perfect. I think the aim of this webinar, we were thinking it was great to get everyone talking and discussing in the community and sharing best practice. So it's good to see a few things that people have done. So the idea of switching or moving to paperless workflows, that definitely seems, I think, anyone who's gone into an office that's been around for a while has seen the amount of filing that we used to use or have been using clinically, and then that seems to be reducing over time. So that seems like a great thing to be doing, and I think lots of trusts are also seeing that that will save them money as well, which is kind of a win-win situation. One of the things that we're seeing is, yeah, sending look, we're using nuclear medicine, lots of lead pots. So there's one option is to send them to scrap metal, but whether there's potentially other options available, and I think Nathan has some more information on some of the options there. And what I have seen is that yeah, it says looks like some of the centres are not doing too many projects. So this is a great kind of time to share what things that people have been doing locally. So hopefully a few ideas for inspiration as well. So one of the ones that I can see there is people looking at reusable PPE. So I've seen a few options. At Imperial, we've run a trial of reusable surgical gowns in our interventional radiology suite, and I know that the Royal Cornwall Trust have done something similar, where they've looked at reusable PPE, and Cardiff and the Vale as well. That tends to be limited maybe to surgical gowns, but potentially people are using those in nuclear medicine, depending on your risk assessment, perhaps for contamination. And I think there are some trusts that are also looking at using reusable masks that we've all been using more since COVID, or how to collect those up and recycle them, or have washable versions. So they're interesting aspects. And despite the fact that we might think that washing these gowns adds to the carbon footprint, it does seem to overall reduce in total the carbon footprint associated with that.
Laura, can I just add a personal note on that? Not just personal, because we're looking at implementing Rev Zero masks. These are reusable masks, 40 washes each. It is problematic. There are lots of things to do to get this in. We're not there yet. But if you are also, if you're also on that, if you're looking at that, it'd be very interesting to tie up and share experiences, share what the issues are. That'd be great, and I can send that out if other people have good ideas as well.
Yeah, I think definitely reusable PPE tends to be something that your infection prevention and control department want to be really involved in, to make sure that everything is safe from that kind of aspect. Yes. Another couple of things that I think often come up with, I think there's a number of clinical scientists or medical physicists in this call, is looking at optimization of services. So trying to do the most that we can with the least amount of, I guess, use of either equipment. So we're reducing the amount of electricity or energy associated with a study. So there's been a few projects where, say, one we've done locally is moving to single time point CCAT imaging, or if you're doing any projects there where you're optimizing the activity administered for patients or your DRLs or the time used for a particular study, then all of that, as well as being excellent MPE work, is all going to be reducing the carbon footprint associated with a particular study. One thing that I haven't seen people discussing here, but I have had a discussion offline with someone about refurbishment and rebuild of departments, and making sure in those kind of aspects that people are looking at shielding equipment or reusing current, redesigning a department rather than starting from the ground up, but being able to reuse some of the shielding that you already have in. And I think in radiotherapy, there's some work on whether concrete can be mixed with different kind of byproducts so that the overall footprint of that is reduced. So that's some good ideas. We do have a discussion then, a question from Claire. We can see that about reusing lead rather than recycling. Which is a really nice point, and I think will probably lead us really well onto the next session. So thank you everyone for contributing and sharing the work that you're currently aware of in your department. It's been really great to hear everyone's points of view, and I think I'll hand back to Rob for the next session.
Cool, thank you very much. I'll stop sharing. So the next session is Nathan. He's from Nottingham University Hospitals, and he's going to be talking about industry developments and presenting the collated response from industry that we've been doing. Cheers, Nathan.
Yeah, thank you, Rob. So again, I've got a bit of a mentee just to get an idea of, if anything, what people may be interested in doing with sort of partners in industry in our sector. Rob, if you could put the link up and the code in the chat, would be good, I think. And I've got a few slides just to make sure I don't miss out anybody that we've talked to. I'll just share the screen. Wait. So we've got just to start off with. Obviously, we've gone out to industry and started talking to various companies in the market that we work in. But as with with everything, it is an open market, and we're only going to share. We're sort of sharing the findings from people we've spoken to, and the maybe alternative things available. So what we're saying this morning is, we're sharing what we've found and what we've found from who we've talked to, but we're not suggesting that these are the only people that can provide these services, or that you should go with a particular provider for anything. So as Rob said, we had a letter that went out towards the beginning of the year to industry. It was sent out to other organisations within nuclear medicine and radiotherapy beforehand, and we got quite a lot of sort of signatures from other organisations within the area, which was really encouraging and valued. And we kind of suggested starting out looking at a few sort of big picture sort of things. So like the optimization of packaging and transport of the products that we use, the use of reusable packaging, so we don't have to throw so much away, and the choice of materials in the packaging and the things that we do put in the bin or that we recycle, to make sure that we're minimizing things as much as possible or making things recyclable. So just to quickly go through the sort of the responses we had an interesting conversation with the guys at Siemens PetNet. So these are this is manufacturing of pet radiopharmaceuticals. They're building a new manufacturing facility, and in that facility, to lower their carbon footprint, they're going to be using a lot of solar energy to power things, which is good. They're also, as Laura was saying, looking to regularly review their processes and the equipment and materials they're using, sort of using reusable PPE or reusable materials, get rid of single-use stuff where they can. That obviously, when you're doing sort of aseptic procedures and things like that, it can be quite challenging because a lot of it is designed to be single-use for infection control reasons. And they're also looking at the regularly reviewing and looking to implement electric vehicles where they can in their sort of their supply and delivery chain. And across sort of all of society, really, there's pros and cons to electric vehicles and the infrastructure we have to support them at the moment, as has already been seen in the chat. and some of the issues raised, and again reflecting the chat, is that some hospitals have electric charging points and some don't. Some routes to hospitals can be quite traffic intensive, so electric vehicles may be more of a challenge there. Keeping in the theme of transport, we also spoke to top speed couriers, rather, and they are a company that move all sorts of materials around, including radioactive materials. They've begun trialing electric vehicles and found a really positive experience. So contrary to what a lot of people sort of say, and the media are quite keen to push, that they've had better than advertised range on their vehicles, so they've not run out of battery power as soon as they start the engine. And their drivers had a really positive experience with them as well. They said they're very pleasant to drive, much easier to drive on long distances. And because of this, they're ordering several more vehicles, and they've got an aim to progressively electrify their fleet over the coming years. And they've got a really good sort of sustainability plan on their webpage, which details that they're looking at getting 3/4 electrified in the next 5 years. As Laura was saying earlier about lead, we all have cupboards and cupboards full of leads at times. GE have brought out a system to start to return some of the lead pots that they send out. They piloted it with iodine 123. My understanding is that they have or are planning to expand it to CCAT capsules and in time I131. And the idea of this is that when we get the cardboard boxes that we get our DAT scan or whatever in, we can then, when the couriers come, send back one of those cardboard boxes with up to 9 lead pots in it, and they'll transport them by road to Norway. There's information available that they've sent through. I can't seem to share documents in the chat, but I've asked the guys at IPEN to share the PDFs afterwards by email to the participants if people are interested in that. And for those of us that work in nuclear medicine departments that are part of a wider imaging sciences or radiology department, they also do a CT contrast recycling scheme as well. These things are all free of charge, which is quite helpful. And it's a really good way of sort of trying to make things a bit more circular and stop, a conveyor belt of stuff coming from supplier to user to waste. There's also a company called Raditech that we've had conversations with. So Raditech make a lot of shielding equipment like cupboards and benching and various bits and pieces. They sometimes are able to take away scrap lead from departments. So if you have, and we certainly found with some of our local waste dealers that they sometimes are not keen on taking the lead pots that are covered in plastic because you've got a lot of mixing materials that is quite difficult to take apart. Raditech have sort of said if they're in the area, they're able to take away lead, or if they come to your department, they can take away some of your lead. So they're all over the place all the time. If anybody wants to drop them a line, of course, other manufacturers of lead things may also do this. And Raditech also refurbish, so keeping in the theme as Laura was saying earlier about when you're looking at updating your department, instead of having to buy everything new, there are companies out there that can refurbish any shielding or any sort of equipment you have around your department. In terms of keeping on with refurbishing, there's a company called GVH Projects, and they have started to refurbish type A radiopharmacy containers. So as with most of the things we buy, we're kind of told it'll last for 10 years, and after that, chuck it away. If some of these containers are still in good enough shape, obviously if they're completely knackered and in pieces, the refurbishment could be a bit limited. But after that 10-year sort of nominal life, they could be refurbished. When they are refurbished, they're still certified as compliant with sort of all the ONR bits and pieces. As with most things, refurbishment is generally cheaper than buying new, which is really, really useful and really good. And our understanding is that the company are also looking at other types of packaging and making things again a bit more circular. So they're looking at trying to provide alternatives to disposable type A packaging and disposable accepted packaging containers as well, so that we can avoid sending things to places and having everything thrown in the bin or recycled. And then we've got the choice of materials as well. So while recycling has become quite a common cultural thing that we all tend to do now, and it tends to be like a go-to way of disposing of things, it's generally a good idea not to have to recycle anything in the first place and just to minimize your materials that you use for things. And we had a really useful conversation with Boston Scientific a couple of months back, looking at within nuclear medicine. Obviously, those of us that have done or do CERT therapies, they produce the TheraSpheres CERT product in Canada. And Boston are a very big company that produce medical devices and products for all sorts of other areas of medicine as well. And to get kind of a useful perspective from a manufacturer end, we sort of talked around the fact that although we may have things come to our centres that we sometimes might think are a bit overpackaged, and I've certainly had a memory stick come from a retailer that's named after a rainforest, that's covered in bubble wrap inside a box, inside another box full of packaging for something that's really tiny. It just seems a bit unnecessary sometimes. When it comes to companies like Boston making, products that have to be stable and have to be in good condition when they arrive, they may come from one country, such as TheraSpheres coming from Canada, and go all over the world. And in addition to you having to comply with, in this case, sort of the ONR, ADR rules and regulations around transport radioactive materials, the products have to be in good condition and stable in whatever environment they're sent to. So one product may come out of a factory in Canada, for example, will be sent to Alaska or the UK, which is more temperate, or a tropical country where it's really very hot, and it's got to deal with all that international wear and international transport wear and tear as well. They do mark all the materials with the relevant recycling codes, so that if you have recycling facilities that you have access to, things can be recycled. One of the tricky things here, they've marked polystyrene is recyclable, and at least in the UK, at least where I am, polystyrene is hard to recycle. It's not something that I think there's an awful lot of infrastructure around here, and that they made a point that if they were to go over and make everything reusable for a product like TheraSpheres, where it comes out of one factory or one area, one country, and goes all around the world, making that returnable and reusable in the same way that GE might within Europe, would be quite time and cost prohibitive, because obviously GE put loads of DAT scan and CCAT capsules out. It's over a continent, we've got a good road network, and it can all come back again. Something like TheraSpheres, you're sending relatively small numbers of products out around the world and sending them back again is not time or cost effective. And also sending lots of odd lead pots that are empty back on an aeroplane, and the carbon footprint generated with the jet fuel and all those sorts of things, there's probably an important analysis there onto what's actually most environmentally sustainable. That they are keen to engage and receive feedback to understand what our waste management practices and recycling facilities are, so that when they develop further products or revise product developments as they go along, they can try and bear those things in mind and make things as good as they can be. And similarly, a company called BXTA, which are a brachytherapy company rather than nuclear medicine, but the principle is the same, were quite keen to engage with understanding what packaging we can recycle, reuse, what has to go into landfill, and try and get some sort of guidance to develop things in future to make them more sustainable. So one of the things we're planning to do as a sustainability committee is try and get some understanding of what recycling practices there are within centres. So I certainly know where I live in Leicestershire, recycling is different to where my parents live 5 miles down the road in a different council. When you go on holiday to a different part of the UK, you have a whole host of different coloured bins with different segregation of waste that's different colours, and it's all highly variable. And I imagine that's the same between NHS trusts as well, to some extent. So we're going to try and get some idea of what NHS trusts are able to do. If that data is located somewhere, then and we can access it, then great. Otherwise, we're going to look at setting up some sort of survey and going out to the community to see what you guys are able to do as the end users. So that's the slides. If we have a look at the chat, and Rob, if you want to share the Menti screen, that'd be great.
Yep, I've just reposted the link because we've only got 6 people so far.
Okay.
But I think it just disappeared in the chat a little bit.
That's fine. If you want to pop it up, it might see the numbers.
Yeah, remind everyone as well.
Yeah.
So we've got 10 people now.
Chat up. Yeah, so Laura said that the GE stuff has been quite successful, which is really good to see. If I'll bring this onto my bigger screen so I can see the bars ticking away. So yeah,
you want some refurbishing equipment. I wonder, or two people refurbishing equipment. I wonder if they could post in the chat if they're happy to do so. What kind of equipment? Is it electronics? Is it Type A's? Is it anything between the two? It'd be interesting to know.
Yeah, absolutely. It's good to see that everyone's recycling lead. It's quite an easy thing if you've got scrap dealers nearby. They can be quite accommodating to taking it. Particularly, I know some of our techs at times have spent a bit of time shelling some of the plastic off the lead, but obviously the time that we have available to do things is getting more and more restricted now as departments have more pressures. So doing that sort of intensive stuff is quite hard. Having a scheme where you can just send it back to the supplier is much better, much more easy to do. It's good to see that people are considering their waste footprint when purchasing things as well. Obviously, when we decide which equipment to buy, we always put the sort of the clinical things, and part of the MPE role is comparing the technical specifications of devices and gamma cameras or whatever when you're buying scanners to see what will suit your purpose best. But it's good to see that its waste is also being considered. That's good. Someone's posted, Matt Walker said that Southern Scientific will take back old Capintechs, which is really good. We've got some old Capintech calibrators knocking around as sort of backups if we needed them. But it's good to see that they can be taken back and reused. We've also had with Raditech took away a old research scanner a short while ago. They took away some of the lead from an old research scanner a little while ago, which even if you're not getting rid of something that's explicitly shielding or vial pots or whatever that is clearly made of lead, other equipment that contains lead may also be useful. Okay, Joe from GVH has typed that he's repairing Type A cases and sorting out some repair procedures. That's really useful as well. I don't know if Raditech would take collimators. It's something you could certainly approach them about and ask them about. When they took, I'm not entirely which parts of this. I'm not sure when they took out our research scanner whether it was the collimators particularly that they took the lead from. So where it was they assisted in the sort of the decommissioning clear out of a scanner by the scanner agent in this country. So it may be that they took apart bits and pieces and took out the lead that they were interested in, or whether there were other things around. It's not something that I was closely involved in, but by all means do ask them. They're based up near Newcastle, and they're easily Googleable. One of the things we have found in Nottingham in bringing in a recycling scheme is how easy it is for staff to put things in the wrong place, because it can be a little unclear, particularly in a clinical area where you've got other waste streams as well. And one of the things we've tried to make sure that we do is make sure there's enough information sort of in recycling hubs around the department. We produce some posters and things to help people put things in the right places for recycling bits and pieces, which has been quite helpful.
Is it worth making the point, Nathan, that there's a dialogue to be had probably between departments and manufacturers? I mean, you've done this, but for me, one of the things that stuck out of this work is that you start with the dialogue before anything changes, because everyone's busy. There's lots of things to be considered, lots of standards to be adhered to. But the more that dialogue happens between a department and a company, and I mean, several people I know have taken the initiative and just got in touch with suppliers. and it puts it on the radar, and it makes people think about it. And sometimes there are simple solutions that can be implemented if someone actually gets around to doing it. And it's probably about encouraging that, isn't it?
I mean, there is, as Laura mentioned with green plans earlier, there is a lot of centralised NHS or things that are being mandated over time, and there are sort of standards and requirements for the supply chain to improve its sustainability. So there is a big sort of organisational push to that. But when it comes to additional products, I think there's some real value that us as end users get in touch with companies and explain, no, in my department for this product, I have noticed this. It's quite specific feedback that can be actionable, rather than the NHS wants these changes to be made sort of thing. I think that's really useful. I mean, Laura, what was your experience with the GE recycling packaging returns? Is there something you want to comment on with that?
I think they approached it, just came out of the blue that they were running it, and I think we've shared, there's a short kind of SOP, that a one-sided sheet that they've explained how that works. As you mentioned, the box, you can put up to 9 of the pots in, each box that has supplied you 1, and then just a couple of changes on the label, and you let them know that you would like that collected, and they will collect it the next time that they're delivering. So there's no separate journey being made there. They're using a courier to take it back on the same time that they would have been delivering you your next option. So that's been something that's quite simple, and I guess we've struggled a little bit to get rid of those pots which have a combination of the plastic and the lead. So this seems like a time efficient way for us to do it locally.
Yeah, and as we said before, I'll get IPEM to send out those GE instructions on how to do things so that people can access them. And there's something that's popped up in the chat about minimizing the size of packaging, which is also something that's really, really useful as well. Obviously, the materials are obviously important to optimize, but if you have a massive box with something in it on a plane versus a small box, and lots of small boxes with things on the same plane, it does make a big difference to the carbon footprint associated with that product, which is good to think about.
In the interest of time, we should probably move on to the next speaker. Sorry, thank you, Nathan. Sure. So the next speaker is David Simpson. He's from the Nuclear Medicine Special Interest Group, which has been running collaboration with. And he's going to talk a little bit about kind of what next and what would you like to see next, and trying to get some discussion with you. And I think he's got a Mentimeter as well. So take it away, David. Thank you.
So yeah, thanks for the introduction. Yes, so I'm a recently joined member of the Nuclear Medicine Special Interest Group, part of IPEM. So this is really going to be a couple of very short questions. So if we want to move,
do you want me to share that now?
If we just share straight onto the Mentimeter. I'll just be very interested in what people would like to see done in their own departments, or in the wider community to improve sustainability. So this is really just to like harvest as many ideas from the audience as possible. So if anybody's got anything particularly that hasn't been mentioned before, I think we had a little bit of chat earlier about use of electric vehicles by staff, and also potentially within radiopharmacy. If anybody's got anything else about that. So this is really just like a free chat area, just for people to post their own ideas. I really think we're in the position where we're wanting to use like wisdom of crowds to actually come up with stuff. I don't think anyone feels like they're the authority or the expert on it. So we'd like to see a more robust inclusion of sustainability in procurement. The calculation of carbon footprint of nuclear medicine and PET practices. Does anybody within the panel want to have a quick response to that? because I know that's something that's of interest at the moment.
That's a section we're doing in a minute. Rob, do you want me to do that now or in a minute?
It might as well, yeah, might as well do it now.
So there is a project that's looking for funding at the moment to do just that. This came out of discussions in actually molecular imaging PET user meetings. And there's a group of us that have put together a proposal to measure the carbon footprint of molecular imaging. So this will be a very broad brush and an introduction, because so far as I'm aware, correct me in the chat if you know different, there isn't a literature on that. There's literature on CT and MR and on X-ray and a lot of other stuff, but not on molecular imaging. So we're starting from nothing, and we're going to incorporate both PET and SPECT, which inevitably means we're basically doing two quite different projects, because generator is very different from cyclotron and so on. But we're looking to get a funding to do that. If there is a proposal which is about to go in to be requested. If you're interested, I've got a little list of email addresses of people interested potentially in helping. Do get in touch with me if you want to join that, or if you have suggestions. I can send you the draft proposal, and sure we can work on that together.
Sure, cheers. You're here, Gary.
So I just saw there was a chat meet. Something came up in the chat to say that the poll has closed. Is that are people struggling to actually add their suggestions to this slide now? Okay. And then there's a chat message to say if you refresh the page, then you can add your suggestion again.
Yeah, I think it was closed earlier. So yeah, actually refreshing it should sort it.
So I can see sharing of best practice, which is something that I might move on to in the next slide. But proof PPE. So I guess some of these things we've touched on, but maybe we're actually looking for a bit more detail before they could be implemented in other people's departments. So maybe we can have a look at the stuff that people have come up with as suggestions, and possibly think about ways we could help support that.
I think there's the comment on sharing best practice. I think the ultimate aim of a lot of this stuff is for us to write some sort of guidance on kind of how to do things in the best possible way from an environmental sustainability point of view. But at the moment, we're just sort of finding our feet and kind of information gathering on that best way. But it's certainly our aim.
Yeah. So if we move on to the final slide, the next slide is last time you're going to be asked for your input. So as we're it's really just what support would you like to see from your professional organization. So as I said, I'm new member of the special interest group, and we have contribution from ENMS and HSE, and we have dialogue with a lot of regulators and a lot of other professional bodies. What would you find most useful as a resource from IPEM to help implement this within your trust? So do you think we should have connections with other groups that that you know of? Do you think articles in scope would be useful? We're really looking for any ideas of how IPEM can help you, or how we can help each other. Have you found this a useful forum? Were you expecting something different that you feel we've missed? If we were to run one of these again, is there something that you would like to see that we haven't said yet? So really this is just an opportunity for any kind of feedback, and everyone is saying guidance and guidelines.
Yeah, it's probably just, I mean, we're kind of, while we're working towards the guidelines, we're sort of putting articles in scope as we go along to try and share what we've found so far. Putting a whole guidelines and kind of good practice document together will take a while, but as we go along, we're trying to put things to scope so we can kind of get it out there without having to kind of make a whole document. So keep your eye on scope as well. And Nathan, is it worth, do you want to mention about the CSH imaging?
I've just copied the link into the chat, and I was finding an opportune moment to interrupt. So there's the Centre for Sustainable Healthcare have a lot of different networks for different parts of healthcare, so for different types of therapy and modalities and things. And one is recently launched for imaging. So it will be, it's not just nuclear medicine, so it's sort of all sort of imaging involving radiation, so radiology as well. I'll pop the link in there now. So obviously it's free to join. It's cross-professional, which is an advantage. Obviously today this is being done through IPEM, primarily obviously the physics and engineering community, but open to others. The CSH network is for all professions involved in imaging, and all modalities. So obviously we can learn from what people in other modalities are doing. People have suggested in some places that there are interest in the literature around energy use and savings with equipment and stuff, and there are papers, as Jerry said, on CT and MR and things, and people sharing those sorts of things on there is the aim of the network. It's like a repository of resources and an opportunity for people to collaborate a bit. So if people want to sign up for that, the link's in the chat. It's free. It's just an online portal you can log into.
Brilliant, thank you, Nathan.
So looking at this, I think the other thing people would find useful is if anyone else has done the work already on which is more sustainable, reusing PPE or single use. If anyone's actually put in the work to look at what the impact of various choices are, to make sure that that's published.
I think that would be really helpful. So certainly some of the conversations I've had have been very cautious about adopting reusable things in various contexts because of historical practices around single use and infection control and contamination control. If people have got case studies and evidence that it works and that it's okay, that might be really good to share.
And there's a discussion in the chat about changes to sharp spins. Actually, I've noticed this just within the last couple of weeks in my own trust, that they've changed the sharp spins to have a grey base part with a coloured lid, and the grey plastic has a higher proportion of recycled plastic. So that's if that's not a change that's happened in your trust yet, it might be something to push for.
One of the things I wonder if it's worth looking at in a specifically healthcare setting is we're all going paperless, and there's good operational reasons for that as well as environmental reasons for that, but possibly less of an environmental argument if that involves the procurement of lots more IT stuff. I think in general, we probably have the IT infrastructure anyway for other reasons, and therefore let's not get a load of paper as well. But that is something that I've not looked at specifically, but I do know there is a big impact in environmental impact from IT equipment and the waste from that. that might be a subject. I don't know if anyone knows about that more than I do.
And so someone is asking for like a single point of contact as a person to be the go-to to answer these questions. They've asked that anonymously, which is probably very wise. That's the sort of question that tends to get you volunteered.
It's reflexive, isn't it?
Yes.
I wonder if the CSH group might be an appropriate point of contact.
Yeah, I think it's a good place to sort of share questions and resources, so that you can post and build up sort of a conversation like you would on social media. There's sort of like an opportunity, you can put a post in and people can comment on it, and you can also share a resource as well, so it can be a web page or an article that you put up there that people can then pull down. It's not monitored by an individual. The idea is that it kind of organically in time will sort of people will respond to each other and it will sort of tick over. But it's a good place for us to sort of to share what we've learned, and if you do join the network and don't turn it off, it will notify you when people post things to the network. So if something comes up that you know the answer to, you can reply to it. I think the challenge of having single points of contact is, as we said before, we're all horrendously busy and cramming these things in. You have to share amongst a big group of interested people to have it progress. So something like the CSH network is quite good in that if people ask a question, it can go out to the network, and if someone knows the answer, they can come back, rather than somebody having to answer questions a lot of the time and it becoming challenging to manage.
That sounds like it would answer another question in the suggestions, which was like a wiki or a community of interest. So it sounds like that, yeah, the CSH would for
we do also have a community of interest within IPEM. It's not overly used at the moment, but one does exist if you already want to use it.
Great. Well, with 5 minutes left to go, shall I hand back to you, Rob, just for any final remarks?
Yeah, so if there's any more questions or queries, then please let us know. We do have the ability to allow you to talk if you have any kind of questions. Feel free to raise your hand. I did think of a paper that's related to PPE. So I'm just going to try and find that quickly and post it in the chat. So it's not about like PPE versus kind of disposable versus reusable, but it does very nicely show the carbon footprint of disposable masks. So that is a very nice paper that can be used to kind of like motivate doing it at least. But I don't know of one that has done a direct comparison, which kind of also highlights that we should, a lot of work still needs to be done to show which is the best process. And whilst we, if the NHS is due to be net zero by 2040, we haven't got a huge amount of time to do this. And some of this work, lots of this work has been done decades ago, really, so that we could be implementing it now, but it doesn't. So it highlights the need to do this work. Someone says, are the manufacturer's responses posted? And I can't see the rest of it.
I think that's maybe a question about the manufacturer's responses to our letter, which we haven't collated yet. Yeah.
Nathan, do you want to have a quick response to that?
Yeah, so obviously we presented the ones that were nuclear medicine orientated primarily, all the ones we've had something to share. I don't know, Laura, are we looking at collating the other bits and pieces that people have said? I don't know whether those things are publishable without reams of corporate sign-off or not. I'm not sure, but the responses that we can sort of action as a community we've shared today, and the things that people are able to offer to us, kind of put out there today, with the aim that people can make use of what we've found out and the replies that we've had.
Okay, I think in the interest of time, we should probably leave it there, because we did say we wouldn't go over one. Thank everyone for joining. Hopefully that's been useful. The IPN group does exist on Twitter and on LinkedIn if you want to join it on there. And I think you have a few of our email addresses already. And if you don't have it, then please go via IFM to contact us. So thank you very much, everyone. I'd like to thank all the speakers as well. Cheers. Yeah. Bye.
Bye.